Now let's look into who needs this hearing test. Based upon that, let's segregate the population into normals, already having hearing loss and using hearing aids, and a population of high risk groups. In normals, let's check if you don't have any ear related complaints or any ear infections, or you never faced any problem talking in a community or having a conversation with other person, then you don't have any hearing issue. But still, if you are under 50, it's better to get checked your hearing every 2 or 3 years to be on the safe side. But if you are above 50 years, let's take age-related hearing loss into consideration. Slowly happens, that is very gradual. So better to get it checked. If you are in a population of already having hearing loss, let's say you have a hearing loss, every year we don't know how much hearing loss is increasing. It's better to get it checked. And if you are already using a hearing aid, a frequent every year checks can help your audiologist to fine tune the hearing aid so that your hearing experience will be better. Now let's check into high risk groups. These are the people who needs their hearing checked very often. Because though you are younger, if you are working in the noisy situations or if you are in a noisy environment, frequently in the concerts and all, then your hearing needs to be checked if there is any change in it. Even if you are using headphones at high volumes, better to get your hearing checked. And if you are having a frequent ringing sensation in the ear or any ear blockage or any middle ear infections, or any giddiness symptoms, please get the hearing tested. Even in the condition where you have diabetes or high blood sugar, because of the medication ototoxicity, hearing loss might happen. The early you detect it, you can prevent the further damage. For this population, an yearly health check will probably catch the hearing loss early.